My name is Dr. Shounuck Patel, DO. I am the regenerative pain specialist at HealthLink Medical Center, RegenX. I focus on regenerative treatments of everything from the spine to arthritis to various other orthopedic conditions. So cortisone injections, they are a type of steroid injection that work by cutting out inflammation. But the same reason that the cortisone injections work is also the same reason that they can be harmful. They cut out inflammation, which we know is the first part of the healing cascade. But when a patient has been in pain for a long time, that inflammation needs to take place in order for the body to start healing again. So the alternative to cortisone injections or surgery that we use in our clinic include all aspects of regenerative medicine. So we use stem cells as well as your own blood products such as platelets and platelet lysate. For example, if someone has back pain and sciatica, I use what's called platelet lysate instead of a cortisone injection into the epidural space. Instead of stopping the healing cascade, we're delivering growth factors that will promote healing. In addition to just treating the nerves with platelet lysate, we treat the facet joints with the platelet-rich plasma or stem cells. We treat the ligaments that surround the whole spine and provide support to the spine. We do that all in concert with each other in order to try to provide benefit to the whole structure of the spine. In terms of stem cells, we're having great success with using stem cells within facet joints, particularly for the lumbar spine or low back that could be hurting you because of arthritis or issues such as whiplash. For the intervertebral disc, that's an area that does not have good blood supply and does not heal well on its own. If the disc is not bulging too much, if the disc has not lost its height, then the stem cells can provide regeneration for those annular tears within the discs. That's not often a first-line treatment because it is an invasive procedure. But if we know that the pain is coming from the disc, then that is definitely something that could provide good benefit. My training in medical school was through osteopathic medical school, and one of our foundations is that the body is a whole and that everything is interrelated, and the proper treatment of various conditions involves the treatment of the whole body. So my philosophy for treating the spine and various other orthopedic conditions is just that. In addition to treating the various aspects that are causing the pain, I need to really address all the structures that are surrounding you. For example, I just had a patient yesterday that has degenerative disc disease and has pain going down his legs, but he doesn't have the proper nutrition that's going to supply his body with the healing powers that's necessary. So we spent the first half of our meeting talking about nutrition and how he needs to optimize that in order to properly heal. That's a part of regenerative medicine, and that's a part that is unfortunately often neglected. And I think that that's why HealthLink Medical Center and RegenX is looking at things in the right direction, because we look at the whole body.